Today, we're going to talk a little bit about advanced care planning, including medical and financial powers of attorney. So what is a medical power of attorney? That's the first thing that we're basically going to talk a little bit about. But by way of a little bit of background, as you're thinking about advanced care planning, part of what you want to do is think about what's involved, who do you partner with? And this is really focused at a little bit on your medical providers, but more than 1/3 of the physicians basically do not focus very well, or they're inaccurate in making decisions or helping people make decisions about their end of life care. 88% of the patients with an advance directive did not receive the services that they wanted. And 60% of Americans want their end of life wishes respected, but only 20% have an advance directive. And this is really important. One of the things that I want to stress to you all is that while you may have conversations with your primary care physician about your advance directives or what it is you would like to have happen, that is only one piece of the overall puzzle. Because most likely, especially if you end up in hospice or if you end up in your last days in the hospital, that primary care physician is not going to be involved in any way, shape, or form in making those decisions because you're probably not seeing that physician. So it's important to know that while you want to include your primary care physician or your healthcare provider, other people need to be informed as well. The second thing to do is basically to create a plan. And 44% of the patients who have an advance directive have discussed it with their doc for, are you ready for this? 3 to 5 minutes. Medicare will pay for a wellness visit in which your doctor is supposed to talk to you about that once a year. But at the end of the day, doctors gloss over it because a doctor's primary objective in the world is to cure and keep people alive. Most of the time, they're not really interested in talking about end of life care. And why do patients kind of drag their feet, or individuals? Well, 60% is because they're not familiar with it, 14% think they're too healthy to need to, and 11% don't really know what to do. So hopefully this will provide some helpful instructions and thoughts about how to do that. And then more than 25% of all of the care is basically delivered in the last few months of life. So 86% of the people who were surveyed preferred to stay at home instead of a hospital. 84% don't want life-prolonging drugs, and 77% don't want a ventilator, even if it adds to their life. So you can see that there's a big disconnect, if you will, between what people want and what really happens in the real world, which is one of the reasons for hopefully giving you some thoughts and ideas as we talk about it today. So a durable medical power of attorney, even if you're unable to participate in your healthcare decisions, your durable power of attorney lives on. So by making it durable, that means that even if you can't be involved, whoever your agent is will be able to make decisions for you. And when you do a medical power of attorney, you have to be competent and you have to be able to give informed consent. Again, when we do surveys, 90% of the people say that talking with their loved ones about end of life care is important, but only 27% have done so. Similarly, 82% of people say it is important to put their wishes in writing, but again, only 23% have done so. This becomes really, really important as we get older and as we experience more health conditions. And think of advanced care planning as not just your end of life decisions, because it can be a whole lot of other things in addition to that. So it's not just the last few weeks, months of your life, but it could be the last 3, 4, 5 years of your life. There are 4 parts that we often talk about in advance directives. We talk about a living will, medical decisions, healthcare wishes, and a healthcare power of attorney. So again, we're trying to make it more comprehensive than just having a piece of paper. So some of the steps that you can go through for advanced care planning is start to think about what are your values, your wishes, and your beliefs. Some of us, and I will use my father sometimes as part of this discussion. My father was a German, first generation. He was a German from Russia. He was the first generation in this country. He was very Catholic, and basically he believed that all of the technology that God gave us was there for a purpose, and that was to use it. And so for him, hospice or any type of taking you off of life support was not an option, because that was not within his belief system. He believed that God decided to just when he was going to take you, not when man took you or doctors took you off of machines. The second thing you want to do is learn about different medical procedures that you may be facing and what they can or can't do. And then think about your options for the legal documents. So, for example, if you have a lung condition, it may very well be that you will need oxygen, that you will need some type of a ventilator to breathe. If you are prone to or have cancer, you may need some type of chemotherapy, radiation. So what's your thoughts about those? Do you want that? Could you tolerate it? Would you like to tolerate it? The third step then is to decide who's going to make those decisions for you. And in many instances, most of us hope that we'll be able to make those decisions for ourselves. But oftentimes we need help as we go through that process. And again, it doesn't mean that we can't be involved. For example, I have more than once been with some of my clients in the emergency room or in the hospital or even at doctor's appointments where the doctor will ask them what they want. And while I always try to include them in the conversation, oftentimes they will look at me and they will say, "You tell them what we talked about." And then they'll correct me or they'll add to it. And that's always very helpful, because then it's a two-way conversation and dialogue, and I can try to express what their wishes are. You have to, and I've kind of moved over into number 4, which is to talk about your wishes. You've got to tell somebody. You can't just keep it to yourself. Somebody needs to be able to speak on your behalf, to be able to really share that information. Because again, if that information isn't shared, the assumption is that they will use the medical profession will use all available medical technology to prolong your life. And then it's really important to record your wishes, basically by filling out the legal documents. But as you can see here, the legal documents are only part of the challenge. So again, step 1, when you are making a plan, is identify who your agent is and who that will be. Always select an alternate. And the reason for selecting an alternate is, again, none of us can predict the future. None of us are able to really know what that agent whom we have selected will be able to do. So they may have their own health issues. They may have their own family life issues. I have actually seen situations where the healthcare agent preceded the individual in death. So having an alternative is extremely important. It makes your life a little bit more difficult because now you have to talk to two people and you have to bring more than one person in, but it will help in terms of getting your health care agent or agents up to speed about what you think is important and how you want your care to be delivered. There are some kind of cool tools out there, which are called value statements, and there are a number of those out there. I really like those. The one that I often use is called the 5 wishes because it helps in the discussion around what do you want and what are your feelings. It allows you to share your opinion. It allows you to have a conversation with someone. Another thing that's important as part of this is to think through what might happen to you. So do a little what the therapists might call role playing. You don't even have to do role playing. It's more of a conversation. So what I try to say to people is, it doesn't matter what my preferences are. What matters is what you want me to tell the people that we are working with. Do you want me to tell them that, say, for example, you had a recurrence of cancer? And do you want me to tell them that, yes, let's go ahead with chemotherapy for 3 months. If you don't respond, then we're going to stop. Or do you want to do some type of a medical procedure? I had a client who passed away about a year ago. The medical profession really believed that she had some type of abdominal uterine cancer, but we could not get a confirming diagnosis without doing invasive surgery. And ultimately, I decided that I could get her through the surgery, but then she would have to leave her friends at the assisted living. And she was very close to one of the gentlemen there. And I knew that she would not do well or survive because the rehab would have to happen not at the assisted living, but in a nursing home or a rehab center. And I knew she would not be happy because she would have lost her entire support system. So again, and she and I had talked about different things over the years about what happens if I can't make decisions. How much, how far do you want to go with medical treatment? Scheduling a meeting with your healthcare providers is really important. And again, if you leave it to part of your wellness check, it's probably going to get glossed over. So set a specific appointment and tell them you want to talk to them about it. But understand that they can be involved in the lead up, but they may not be involved at the very end of life. And then complete the documents. Once you have completed the documents, share them with both healthcare power of attorney, with your family, and with healthcare providers. It's important also to know that you should look at these documents annually, if not annually, maybe at least every other year, to make sure that this is still what you want. Sometimes what happens, and I'm thinking again of an older lady that I have been working with more recently, who was really a couple of years ago against hospice. I don't think she wants hospice at this point in time, but as her health and her breathing have become more difficult and her ability to live independently, I think she's probably getting closer to maybe not wanting to take all of her medications, which basically starts the process of hospice in a formal or informal way, because she told me yesterday or the day before that she didn't really care anymore about getting her medications refilled. It's also important to make whatever revisions you need, because some people may not be willing to serve anymore, may not have the ability to serve. So it's important that you work on that. So what's important to you? So in addition to who is your healthcare agent, who is that person that you trust to make your decisions for you, either in collaboration with you or for you if you're not able to do it. The second thing is, do you have small children or other people that you are involved with? So I, for example, much to my surprise, when I was doing planning some years ago, now have a 2-year-old that I have full custody of, which means that I have to update a whole bunch of things that I have actually been remiss in doing from the medical power of attorney form. They are legally done with the courts, but if I can't take care of that child, and I joke about it, but by the time that child gets to be 18 years old, I'll be 90. And I don't know how much time and energy I'll be able to take care of a teenager. And then for many people, they also have pets. And so, again, thinking through what should happen to those pets, I can't tell you how many times I have had over the years to call my friend who is very good at taking pets to the no-kill shelters, whether it's dogs or cats is usually what it is, so that we can get those pets taken care of. And people have to give up their pets many times as they get older, because again, they can't take care of them. They have to move to an assisted living or a nursing home, whatever the situation is. What are your thoughts about organ donation? Do you want to give your organs? Do you want to give your eyes? If your heart is still good, do you want to donate it? Do you want to donate your bones, your skin? If you have, your lungs are still working, or your pancreas, organ donation is a whole process. And over the years, I have done a separate YouTube video on how to donate organs as well. Other things to think about is, what are your choices about your body after you die? So do you want a natural funeral in which you have your body, put in water and it deteriorates that way? Do you want a cremation? Do you want a traditional burial? Do you want a viewing? Do you want any kind of services? Do you want to help plan those services? If you have certain religious beliefs, you will want to probably follow those religious beliefs. And, for some people, those are really, really important. What kind of life-sustaining measures do you have or do you want? This, again, gets into things like, do you want feeding tubes? How much chemotherapy or radiation do you want? Do you want to be put on a ventilator? Do you want to be put on CPAP machines? Do you want oxygen? What is it that you want me to do? What kind of medications do you want me to make sure that I make sure that they provide you? You can live a long time with a lot of kinds of medications, especially if you are taking things like blood pressure medications. If you discontinue your blood pressure medications, oftentimes that will result in a lot of pressure on your heart. It may cause a stroke. And then, your life often will be hastened if you discontinue those kinds of medications. Life-saving is really gets into a lot more, as I implied here a minute ago, around things like ventilators, things like feeding tubes, things like oxygen. Most people will opt for oxygen because it's kind of a low level life-saving measure. But often people will say, I don't want to be on a ventilator, or they'll say, I don't want to have a feeding tube. But again, those are your personal preferences, and whoever is acting as your agent, they need to know that. Again, here is just basically a little bit of information about sharing your feelings. How do you feel about tube feeding? Do you want a hole in your stomach? And do you want somebody to pour liquid into your stomach every single day? Are you able to do it? Do you have to have someone else do it? Some people find this to be very burdensome. Certainly not a service that could be provided if you were in assisted living, could be provided if you were in a nursing home. Ventilators used to be that these were only provided to help you breathe in hospitals, but those now can also, depending on the specialized long-term care hospital or nursing home, sometimes will take ventilator patients, and they have trained staff who can manage them. Radiation and chemotherapy. The big question for me in that is it might extend your life, especially if you're 85 or 90. It might extend your life for a few weeks or months, but oftentimes has very negative side effects and symptoms. And so sometimes people will say, I would rather spend the last 6 months of my life with a quality of life rather than a quantity of life. Other people want quantity, and they're willing to go through whatever the sacrifices that are required for radiation and chemotherapy. Hydration and nutrition are another thing. This is especially important in usually the last few days of life, especially if you are on hospice. So do you want to have us give you IVs with water or saline or whatever? Do you want to have that discontinued? And again, there are preferences on both sides that you will need to make. When someone makes a healthcare decision, if you're not capable of saying yes or no, then basically you want that person to make the decision that you would have made. Here's some things that often are asked of your healthcare decision maker or your agent. So, and if it's not asked by the provider, you want to coach, if you will, your agent to ask these questions. So what is the condition and what's its likely course? Going back to my lady who had the unconfirmed cancer. What are the current wishes and specific instructions that you either have left or you want to leave? And again, this is assuming that now someone is acting on your behalf. What are your medical options, the risks, benefits, other treatments? Sometimes the alternative treatment, again, might extend or give you more quantity of life as opposed to quality of life. And then what are your values, beliefs, and preferences that you were expressing? So what are your wishes at end of life? What kind of care do you want? Do you want acute and maintenance care, or do you want hospice and palliative care? If you want acute, and maintenance care, then I am going to, or whoever your agent is going to continue all available medical procedures. And these medical procedures are designed basically to cure the situation. So they're designed to cure the heart failure, kidneys, liver disease, whatever you may be undergoing. It may involve surgery. It may involve some very complex medical procedures, with all of them with the intent that we are going to give you quantity of life. Quality may be in our thought process, but for the most part, anything on the acute and maintenance treatment side is going to increase the number of days that you live. If you choose hospice and palliative care, basically now you are looking at end of life medications, and or maybe some curative procedures. But for the most part, we're going to discontinue things like insulin, like blood pressure medications, maybe heart medications. If you choose hospice and palliative care, mostly hospice, palliative will usually continue the medications. And we still often somewhat aggressively treat conditions. Hospice, we usually stop treating conditions, but now we focus more on pain management. We focus on oxygen. We focus on hydration and nutrition. And we're really focusing now on quality of life. What memories do you want to leave? How do you want to be remembered? What are the things you still want to do? I have people who go on hospice, and sometimes they're on hospice for 120 days or more, because they've gone on hospice early, so they're able to enjoy the benefits of hospice, but it also then really allows them to do certain kinds of things. I'm always reminded, some of you may remember a gentleman who was a columnist for the Rocky Mountain News, and he went on hospice early. And one of the things he was able to do in his later months was he took his whole family to Hawaii. And everybody was like, so why was he able to continue his hospice services? Because he took his hospice nurse with him. He had the money to do it, but it gave him great pleasure to spend 60 days out from passing away with all of his family in Hawaii. Most of us can't do that. It's kind of an outlier. What are your priorities for end of life? So, as you are in the last few days, weeks of life, do you want to be able to recognize that you are dying? Do you want to be able to communicate with family and other loved ones? And you want to be able to have people know that you're passing away? How involved do you want family to be involved in your dying and your decisions? And can we develop an individualized plan of what we want to happen over the next few months, the next few weeks, whatever it is that we're looking for? So again, do you want to be able to see all your family? Do you want them to not be able to see you sick? I'm always amazed at how many people will tell me, I really don't want my family to see me this sick. And I say, that's your choice, but maybe you want to reconsider, and maybe you want to ask them if they'd like to come and visit with you. Another decision as you go through this is, what are your preferences about where you want to live? Do you want to live in your own home? Do you want to live in an assisted living if they can meet your scope of services? Or do you want to live in a nursing home? And I know the majority of you are going to choose that you want to live in your own home. And what I always tell people is, we will do our best to keep you at home. However, There are days and times when situations occur that I can no longer maintain you at home. So, for example, I could keep you in your own home if you have somebody to help you in the last maybe week of life. But I can only keep you there once you are not able to turn yourself, if you're not able to get out of bed anymore, if you're not able to have someone to assist you, if you are able to get up and go to the bathroom, or if you need to have the adult diapers changed, if you need to have, if you wet your bed and you need to have the bed changed, somebody needs to be there sometimes to make those things happen. And I might not be able to leave you in that situation. In assisted living, if you are living in assisted living, usually we can keep you in hospice in the assisted living through your last day, assuming that hospice is involved and that the facility staff have been trained specifically to provide care for you over and above their general training. And then obviously the other is a nursing home where most people do not want to go, but sometimes I do have to place people there. What again are your wishes for your last day? So do you want people to be physically present with you? Do you want people to come and hold your hand, to stroke you, to lay up on the bed next to you, to massage you? One of the things that was the most wonderful thing that I observed is a neighbor of ours. They had a Down syndrome child. She was like in her 90s. And the most heartwarming thing that happened the day I went by to visit was that the little Down syndrome girl who was living in a home where she was independent with supervision was laying on her bed, and mom was just cajoling her and stroking her. She was very well aware that mom was dying, but this was her opportunity to lay really close and to be in mom's arms for as many days and times as she could be. And although she was not laying in mom's arms when she took her last breath, she was holding mom's hand. And the other siblings, there were 5 other sisters, and they made that happen, both because it was important to mom and it was important to sister. What other kinds of things do you want? A comforting mood. Do you want it to be absolutely quiet? Do you want low calming music? Do you want to be able to see outside? What is important? What kind of involvement do you want people to have with you as the dying person? Do you want them to share moments? Do you want them to make memories? Do you want them to take pictures? Do you want them to tell stories? Do you want them to come and share picture books? What is it that's important? So the next task then is to complete the medical power of attorney. And on our website, we have a toolkit that's called How to Basically Complete Your Medical Power of Attorney. And you can click on this website or on this link when I send you the slides, and you can go through that step by step. There's also a YouTube video on our YouTube playlist, which kind of walks you through that. The do's and don'ts of advanced care planning: start the conversation early and involve other people as appropriate. You also can't do this just overnight. You need to be spending time not only with yourself, but with those people around you. And even if you only have, say, you have more than one child, and the one child you've appointed as the agent, it's important to talk to the other children as well. For example, when my brother was so I have there's 5 girls and my brother. And fortunately, my mother died of a very sudden heart attack, and we didn't have to have the hard decision. But I knew in my heart that my brother would never approve of hospice for my mother, even though one of my sisters had been a hospice nurse for 10 or 15 years, and the rest of us prescribed it. So again, we could not get my mother to write anything down in writing. She just would not deal with those issues. And sticking to your own morals and values is really, really important. Don't rush the conversation and don't do it negatively. Let people know that just like you made a will, just like you were deliberate about deciding to get married, like you were deliberate about jobs that you were going to take, you want to be deliberate and thoughtful about your advanced care plans. Don't be afraid to ask questions or let your children ask questions. Years ago, 10 years ago or more, when my daughter moved to Madrid for a study abroad, we had a family meeting in the living room. And although nobody was thinking about advanced care planning, it was like a 2 or 3 hour conversation about if this happens, what, and how important it is for her to be able to come back to the States. So one of the things that's in my husband and my advanced care planning is, although we have a cremation plan for both of us, do not in any way do the cremation without first letting her get back to the States to be able to observe the body, because that's important to her for closure. So again, while that's a very important detail and it will take some planning, and you have to set money aside to be able for her to fly back on not a planned airplane ride. So again, those things are important, and it's important to her. And if it's important to her, it's important for me to be able to make sure she can do that. Don't be afraid to ask questions or let people ask questions of you. And don't assume that your doctor knows what's best. That's your job. So now I'm going to switch to a financial power of attorney. And basically, there are 2 types of financial powers of attorney. There's a specific power of attorney and a general power of attorney. So a general power of attorney allows the agent to make a wide range of decisions. It's your best option if you want to maximize your agent's ability to handle your assets and manage your care. What happens is that person can do all kinds of things on your behalf. They can sell your property, they can make medical decisions, they can buy you clothes, they can trade on your stock portfolio, they can buy you a funeral plan if you need one. They can do all of those kinds of things. A limited power of attorney really restricts your agent's power of attorney to particular kinds of assets or things that they can do. And as a limited power of attorney, in my opinion, is really fine if I'm going to be out of town and I have a real estate deal to close, or I need to sell some stocks because that's when the sell date is and I can't do it. So it usually has a very limited start and end date, and not something that happens for a very long period of time. My suggestion is, as we get older, a general power of attorney is much, much better, because it allows you and your agent to really take care of you and to do what is necessary, making a wide range of decisions. A financial power of attorney, just as a medical power of attorney, is a legal document. So it will, if it's done properly and done correctly, it holds up in court. It's a contract, it's the ability, you charge someone with making decisions for you. And if they don't make those decisions for you, as a principal or as the agent, they can be sued. There are consequences for not doing it correctly. You can go to jail. So a power of attorney, as I said, is a written document. It gives that agent the power to make decisions. It's often prepared for convenience, but in the case of unforeseen events where the principal may not be available in person. But the most important thing to know about a power of attorney, whether it is a limited or whether it is a general power of attorney, it dies. The power of attorney dies the minute you die. So that's why it's also problematic sometimes for what are we going to do once the individual passes away. At the point and moment that you die and your power of attorney dies with you, then your will or the executor of your will is what takes over then and controls your decisions. Excuse me. Oftentimes, people who even are the agents don't realize that, and they try to act with that power of attorney after the person has passed away. Important when you are appointing an agent that it is someone you trust. It should also be someone who at least has some level of understanding about checking accounts or savings accounts or finances or whatever. If you have a complicated life and you own real estate or you own rental property or you have stocks and bonds or those kinds of things, multiple life insurances, then you're going to want someone who can understand and manage all of that as your agent if you are not able to do that. And then again, we always want to appoint the successor agent for the exact same reasons that we appoint a successor agent or a alternate for the medical power of attorney. So I sometimes tell people, if you give me a power of attorney, you have basically given me the power to do everything that you could do for yourself. It's a very powerful tool, and it makes me as a person, I have to be really conscious about what I can do. This is where we get sometimes into fraud, abuse, exploitation, because people do have the ability with a power of attorney to take advantage and to do things not in your best interest, but in their best interest. So the power of attorney can sell both your real property, which is your house, your antiques, your jewelry, your rental properties, anything like that. It gives them the ability to dispose of your personal property. So if somebody got really stupid and they decided that they wanted to kick you out of your house, they could literally sell your bed out from your house, and you would have to sleep on the floor or sleep on the street. They have the ability to buy and sell stocks, bonds, commodities, options. Again, you may have a really conservative stock portfolio if you have one. They may decide that they need to make more money, so they may sell your stocks and put them into higher risky stocks. They have the ability to go to banks and financial institutions, put their name on your bank account, and they can do anything with your money that you could do yourself, including spend it very wisely on your care and do what they need to do after, turning it over to the executor or the personal representative of your will at the point at which you die. They can buy and sell insurance policies. They can cash them in. They can buy and sell your annuities, cash those in. Again, those are very powerful things. And for clients, I have done all of those things over the years because I have been a power of attorney for probably somewhere between 30 and 40 people in my last 20, 25 years that I have worked in the field of aging. And I've had to do all of these things on behalf of my clients because I needed to provide for their care. They can decimate or be a very good steward of your estate. They can have access if you have a trust. They can file lawsuits on your behalf. They can be sued. So again, who are these people? They could cash out your retirement plan. They're supposed to pay out your taxes. They're supposed to apply for any kind of Medicare, Medicaid, Social Security, all of those kinds of things. They're also supposed to pay your taxes. The general power of attorney gives instructions to the court to appoint your agent as necessary, if necessary, to be your conservator, unless there's a reason that the agent has been abusive. So one of the things is that sometimes there's conflict, if you will, among family members or community members or people who have your sort of best interest at heart, that they believe that your agent may not be doing things in your best interest. If, for example, there's litigation, you go to court, you have the ability in your general power of attorney to say to the court, if this person is not abusing me, if they are taking care of me, they are doing their due diligence, please appoint them as my conservator because that is my number one choice. If the person is being not a good steward of your finances, the court does not have to follow that. It just has to take it into consideration. A general power of attorney does have to be notarized, unlike a medical power of attorney, which just needs to be witnessed. You should share copies of your power of attorney form with the power of attorney and the alternate. And then you need to add their names to be able to manage all of your financial instruments. If you do it yourself, this is great. Otherwise, it can be done by the agents themselves if that is necessary. It's usually a little bit more complicated process because then, like if I don't have access to somebody's bank account that I'm power of attorney for, then I will have to work with their legal department at the bank, but usually they're approved and it's not a really big problem. Especially if you're using Colorado preferred pre-prepared forms, or if you've had it filled out by an attorney. So similar to on our website, the medical power of attorney, there's a planning toolkit on how to do a financial power of attorney. And at our website, at our YouTube channel, there is also a playlist on how to do that. And so that brings us kind of to the end of these conversations today. Just very briefly, a little bit about society programs. We do try to help people meet the social determinants of health with some of our limited services. Some are more widespread, but we do provide dental services. We have some mental health counseling and telephone buddy services. This is part of our advanced care planning series. We do deliver holiday baskets at the holidays, trying to help with some level of food insecurity. And then we do Medicare, Medicaid counseling. We are launching a big effort over the next few months to help with tax credits and rebates. If any of you on this call are taking care of a child that is under the age of 5, and you're providing more than 15 hours a week of care, you could be eligible for a new tax credit of up to $1,200 per year for a single person. If you and a spouse are taking care of a child and you're providing 1,440 hours of care, you could be eligible for $2,400. There is a link on the front page of our website if you want to check into that. And then we still do a lot of benefits counseling, trying to help people get into services. These are some of our other services. Our Salute to Seniors will be August the 22nd at the Greek Event Center this year. We still have our locators still involved with the legislature and regulatory stuff. We'll be doing our Medicare outreach, and then we have some listservs and texting services. And if you'd like to be getting notice about any of that, please let us know. Thank you all for joining us today.